There's a moment after 70 when you start noticing something most doctors never bring up. It's not a symptom and it's not a diagnosis. It's a shift in how your body responds to stress, healing, and even simple decisions about testing. I see this every week in my practice. A senior walks in with a stack of orders, blood work, a scan, a screening, and a look that tells me they're not sure whether to feel reassured or worried. If that's familiar, you're not alone. And none of this means your doctor is doing anything wrong. It simply means your biology after 70 plays by different rules than it did at 50. The very tests that once protected you can begin to carry risks that outweigh their benefits, especially when your tissues, your immune system, and even your hormone rhythms move more slowly than they used to. I've watched strong, capable seniors lose weeks or months of independence because of a chain reaction triggered by a single unnecessary test. Not because anyone made a mistake, but because aging changes how the body tolerates procedures, anesthesia, radiation, and even emotional stress. And that's why this conversation matters. Understanding these differences isn't just medical knowledge, it's a way of protecting your future strength, mobility, and presence with the people who still count on you. One of my patients, Robert, came to me at 78 with 3 test orders in his hand. He wasn't afraid of the results. He was afraid of being pushed into a decision he didn't fully understand. What he discovered changed everything about how he navigates his healthcare, and you'll see why as we go deeper. So stay with me. The 5 tests we're about to walk through aren't inherently bad, but knowing when they help and when they quietly put you at risk can save years of quality life. And in just a moment, you'll see the biological reason age transforms your relationship with testing. When you cross into your 70s, your body starts sending signals that testing guidelines don't always account for. One of the most important changes happens deep inside your cells. The processes that repair tissue, regulate inflammation, and control growth begin to slow. Not in a dramatic way, but in a quiet shift that creates a very different risk-benefit equation for medical testing. Your inflammatory pathways, especially IL-6 and CRP, tend to run higher with age. That means a procedure that causes mild irritation in a 50-year-old may trigger a much stronger response at 75. The same principle applies to the way your immune system reacts to biopsies, anesthesia, and even contrast dyes. Think of it like an older engine. It still runs, but every disturbance takes a little longer to settle. Another key factor is metabolic reserve, the energy your body has available for healing. Research from the Journal of Gerontology shows that seniors experience slower wound repair and reduced tissue resilience. A small perforation during a colon procedure, a needle biopsy, or even minor bleeding can take longer to heal, increasing the risk of complications that wouldn't have mattered decades earlier. Then there's the tumor biology shift that most people have never heard of. As we age, many cancers grow more slowly because cell division naturally decreases. Studies from the American Journal of Clinical Oncology show that prostate and breast cancers in older adults often take 10 to 20 years to become clinically significant, longer than the average remaining lifespan for many individuals after 75. That means some tests detect conditions that will never cause harm, yet the treatments can dramatically reduce quality of life. Robert, the patient I mentioned earlier, had no idea his age changed how his body interpreted testing stress. Once he understood the biology, he realized the question wasn't, is the test available, but does this test improve how I'll feel and function in the years I still have? And the surprising part comes next. When we look at the first test most seniors are urged to take, as we walk into our 70s and beyond, the question is no longer, is this test available? It becomes, is this test still right for the way my body works now? Because the truth is simple, but rarely explained. After 70, your biology changes in ways that most routine screening guidelines never fully consider. Decisions that once seemed straightforward suddenly carry different stakes, not because doctors are careless, but because aging shifts the balance between benefit and risk. Let's take our time with this. Imagine you and I sitting together at my clinic desk. No pressure, no rush, just clarity. These are the 5 tests I want every senior and every family member who loves them to understand deeply before signing a consent form. 1. PSA screening for prostate cancer. After 70. For many men, this test arrives quietly, almost automatically. A blood draw, a number, a curve on a chart. But what most people never hear is that prostate cells in older men divide far more slowly than in middle age. A large body of research shows that many prostate cancers found after 70 grow so slowly they would never cause symptoms in your natural lifespan. Yet, a slightly elevated PSA can set off a chain reaction, a biopsy which is far from harmless. I have seen infections that took weeks to overcome, bleeding that required hospitalization, urinary retention that led to catheter use, one of the fastest ways to lose confidence and independence. And even when the biopsy finds a very slow-growing cancer, the recommendations can become aggressive: surgery, radiation, hormone therapy. These treatments can lead to incontinence, erectile dysfunction, pelvic pain, and long periods of recovery. Imagine losing control of your bladder at 78 because of a cancer that would never have harmed you. I've seen that happen too many times in my career. Robert, the patient I mentioned earlier, sat across from me with worry in his eyes. His PSA was only mildly elevated, something caused just as often by benign enlargement. When I calculated the biology of his tumor type and his life expectancy, he realized the cancer would need 15 to 20 years to matter. He looked at me and said, "If I reach 93, I'll come back to talk about this." 5 years later, he's still active, still independent, and still untreated. Knowledge gave him freedom. 2. Colonoscopy. After 75. Colonoscopy is a fantastic tool when the body is still prepared for it. But after 75, especially if previous colonoscopies have been normal, the equation shifts. The lining of the colon becomes thinner and more fragile. The body handles anesthesia differently. Recovery takes longer, and the risks of complications rise far more sharply than people realize. The American College of Physicians recommends against routine colonoscopy after 75 for average-risk adults with prior normal results. Why? Because many polyps in older adults grow slowly or never become dangerous. Yet the act of removing a polyp can cause significant bleeding, infection, or even bowel perforation. I've seen seniors who were active, driving, gardening, cooking for their families, suddenly spending weeks recovering from a procedure that was meant to keep them safe. If you have no symptoms like unexplained weight loss, changes in bowel habits, or blood in the stool, the first step isn't necessarily another colonoscopy. It might simply be asking your doctor whether a less invasive screening, like an annual FIT test, would be appropriate. Sometimes the gentlest path keeps you strongest. 3. Mammography. After 75. Breast cancer screening is deeply important earlier in life, but after 75, things change in a way many women never hear about. Cellular aging, what scientists call senescence, slows the growth rate of many breast tumors. A comprehensive JAMA internal medicine review shows that while mammography after 75 often detects abnormalities, treating those findings does not extend life for most older women. But the treatments themselves, surgery, radiation, chemotherapy, can take a meaningful toll. Decreased mobility, fatigue, loss of appetite, higher risk of infection, slower healing. I once worked with a woman named Elaine. At 82, she still walked 2 miles most mornings and tended to her flower beds with pride. After a mammogram found a suspicious spot, a biopsy confirmed a slow-growing cancer. She was encouraged to undergo surgery. The surgery weakened her. The fatigue made her stop gardening. Her balance declined. Her world became smaller. not because of cancer, but because of the cascade that began with one screening. The question isn't, can this test find something? The more powerful question is, if it finds something, will treating it make my life longer, or simply make my remaining years harder? That question alone has changed the decisions of countless women in my practice. 4. Tight glucose control and frequent diabetes. Testing. This one surprises almost everyone. For decades, we were taught that lower is better when it comes to blood sugar. But after 70, that motto becomes dangerous. Your pancreas doesn't regulate insulin the same way it used to. Your liver stores less glycogen. Your body doesn't recover from hypoglycemia as quickly. That's why the American Diabetes Association now recommends higher target A1C levels, often 7.5 to 8.5 for many older adults. This isn't being lenient, it's being safe. Hypoglycemia in seniors can cause confusion, fainting, falls, fractures, and emergency hospitalizations. I've seen strong, steady men in their 70s become disoriented and collapse in their kitchens because their medications push their blood sugar too low. That single moment, that single fall, can change everything. One of my longtime patients, a 76-year-old with type 2 diabetes, insisted on keeping his A1C around 6.2. On paper, that looked great, but in real life, he was exhausted, shaky, and anxious. When we adjusted his medications and let his A1C rise to a safer level, his ENE, his energy returned within weeks. He started walking again. He laughed more. He felt like himself. Sometimes a higher number is not a failure. It's protection. 5. CT or PET. Scans done just to check for cancer. These scans are powerful diagnostic tools, but using them without a clear reason is risky. After 70, the body becomes more sensitive to radiation, and CT/PET scans almost always find incidentalomas, small nodules, old scarring, tiny cysts that mean nothing, until they trigger a cascade of anxiety and follow-up procedures. A major JAMA internal medicine study found that 23% of seniors who had routine imaging ended up undergoing invasive procedures that offered no benefit, no improved survival, no reduction in symptoms, just stress, risk, and recovery time. I've seen tiny lung nodules, nothing more than old inflammation from a cold decades earlier, lead to biopsies that cause collapsed lungs, infection, or prolonged hospital stays. Not because the doctors were wrong, but because the initial scan wasn't truly necessary. If there are no symptoms, no specific concerns, no red flags, sometimes the strongest choice is to simply not search for problems that may not exist. These 5 tests are not the enemy. They have saved lives, and they still do, when used at the right age, for the right reasons, with the right goals. But after 70, the body moves into a different chapter, and the priority becomes protecting your strength, your independence, and your time. In the next segment, we'll talk about how to turn this knowledge into action, what to ask, how to approach your doctor, and how to make choices that align with your goals, not just standard protocols. Understanding the risks behind certain tests is only the first step. The real strength comes from knowing how to navigate the medical system with clarity and confidence, without feeling rushed, intimidated, or pressured into decisions that don't match your goals. And this is where most seniors and many families feel lost. They know something doesn't feel right, but they don't always have the words or the framework to say it. The truth is, after 70, good medical care becomes a conversation, not a checklist. Your doctor may be following long-standing protocols, and those protocols often come from data on people much younger than you. That doesn't make your doctor wrong. It just means your body, your priorities, and your remaining years deserve a more individualized approach. The first tool I give every senior is simple. Before agreeing to any test, ask what I call the 3 protecting questions. They sound gentle, but they shift the entire conversation. The first question: how likely is this test to find something that will affect my life expectancy at my age? Not in theory, not in younger adults, but your life expectancy, given your mobility, your health, your strength, and your daily function. The second question: if this test finds something, what would the treatment be? And how would that treatment affect my independence and quality of life? Many seniors discovered that the treatment carries more real-world risk than the condition itself. And the third question: is there a safer or less invasive alternative that gives us most of the information without exposing me to unnecessary harm? Most doctors appreciate this question. It helps them rethink what is truly needed versus what is habit. In my practice, seniors who use these questions consistently make better decisions. They feel calmer. They avoid procedures that would have taken weeks of recovery. And they stay stronger for the moments and people that matter most. In the next part, we'll pull everything together so you can move through your healthcare with clarity, dignity, and confidence. When you reach your 70s, your health becomes less about chasing every possible test and more about protecting the strength, clarity, and independence you still have. None of the tests we talked about today are bad. They're powerful tools when used for the right person, at the right moment, for the right reason. But aging changes the math. What once protected you can, without context, become a source of stress, risk, and unnecessary recovery. If there is one message I want you to carry with you, it is this: your choices still matter. You are not at the mercy of a system. You are not obligated to say yes just because a test was ordered. Your voice is part of the treatment plan, and asking for clarity isn't resistance, it's wisdom. I think often about Robert. Once he understood how his age shaped the risks and benefits of testing, he didn't feel afraid anymore. He felt grounded. His decisions became deliberate, not reactive, and he protected years of independence simply by pausing long enough to ask the right questions. As you move forward, remember a simple trinity that has guided thousands of my own patients: clarity before testing, priorities before protocols, quality of life before numbers. When you let these 3 ideas guide your choices, you not only protect your health, you protect the days and years you still want to enjoy with the people who depend on you. If this conversation helped you understand your health in a new way, stay close. You deserve guidance that treats you like a person, not a checklist. And we're building a community that believes the same. Take a breath, stay informed, and keep choosing the life you want to live.